local roads, limiting speed to about 30 kilometers per hour, has led to a 70% decrease in child pedestrian injuries and fatalities. How many of you drive at 30 kilometers per hour? Do you even know how much 30 kilometers per hour is? Does any one of you look at your speedometer when you're riding your two-wheeler or your car? How many? Just be honest. There's no judgment here. 30 kilometers, exactly. So local roads, 30 kilometers, and arterial roads, 50 kilometers per hour. Another intervention is using of separate bike lanes. That has shown about 44% reduction in bike deaths in cities, urban cities. Again, these statistics are coming from high-income countries. We need statistics for low-income countries, and for that we need data. Now, when we talk about cost-effective interventions, that is the cost-benefit ratio of intervention to the medical cost and the quality of life. Now, so every dollar spent on child restraint system saves $34. Every dollar spent on lane painting, having a dedicated bike lane, saves about $61 to $70 for the medical and quality of life. Every dollar spent on zero tolerance on alcohol for youths less than 21 years of age saves about $25. So the intervention packages really need to incorporate youth when designing all these interventions for a long term. Yeah.
Thank you, Dr. Patel. And so as sir told that this is a skewed panel, but I would like to raise a very important point that the entire road traffic injury epidemiology is skewed. It is skewed to the gender who are sitting on this panel. Just on the lighter side. And that's a very important, because that is also an evidence base, because you need to target this specific age group as well. So without having much discussions, I would just like to summarize that we have, this panel is trying to bring about key issues, key risk factors among youth, the key types of injuries that youth are prone to, the severity in which they land up in hospitals, the modalities of managing these injuries, and the aftermath of the management, and most importantly, the enforcement of these traffic violations among youth, the advances or newer methods in bringing about making these enforcements more effective, and lastly, ensuring that the whole sort of road safety injury programs are integrated with ongoing youth and child health programs. So if you actually put this into a nutshell and add few more components, the only way out is to have a well-implemented safe systems approach to reduce injuries among youth. Now we will have that discussion for some other day, but we would like to know from the audience. We would like you to ask questions. We would like you to narrate your experiences from your parts of the world. So I just would like to throw upon this panel discussion to the audience and request them to ask questions or comments to the esteemed panelist here. Please introduce yourself, your country, and then you can ask your question.
My name is Hannah. I am from Brazil. And my question is, has said that we usually have pedestrians and two-wheelers. So I would like to know if these two-wheelers involves also bicycle, and because I usually associate it with the motorcycle, right, and scooty. And I do have my bicycle. I study in Gujarat, and I never feel unsafe. Recently, I started learning scooty, and sometimes I go outside, and I do feel very unsafe. And recently, also my friend from Nepal, who studies there, she had a minor accident, and it is very. It's very because even if you follow, I think you mentioned seven little steps that you are going to avoid. I don't know if it was 7 or 8 right now, but that you will avoid any kind of accident. But sometimes you're doing your best and still you encounter much more in this country. That's what actually happened to this Nepali girl. She was all right, and then someone just clashed her, and the person was in speed. Thankfully, she was not. Thank God, she was not, severely injured, but it can be anyone. And yeah, so what can we do?
Yeah, in terms of two-wheelers, it's primarily motorized two-wheelers, not bicycles. Bicycles constitute a very minority of the accidents. If you classify fatal accidents as those as self-accidents and those as non-self accidents caused by somebody else, self-accidents constituted about 22%, of which two-wheelers are 87%, right? So at least self-accidents will be preventable if you follow these measures. Secondly, these measures will not, I would say, completely eliminate accidents. It would reduce the risk of injury and fatality if an accident happens. So if you are wearing a seat belt, if there's an accident and if there are airbags in that car, the airbags would deploy and the severity of injury would reduce, right? If you're not on a mobile phone, your concentration would be better. So probably you might be able to avoid or maybe mitigate the risk of injury. So following these things by everybody would reduce the number of accidents, but would not completely eliminate it. And even if an accident happened, the type of injury would reduce, or a fatality would be a non-fatality.
Sir, my question is regarding accident response. So we see that a lot of times after an accident happens, there is no immediate response either from the people who are around or from other responsible people. So don't you think that is there any concentrated efforts made by the police, or is there any internal policy for accident response? Or do you think there needs to be some institution or department within the police, at least for handling accidents in accident-prone areas like highways or something?
I think it would require holding of hand between public and police. There is a Good Samaritan law which states that the police cannot even ask who brought the person to the hospital. Just ensure that he's got to the hospital within that golden hour. Not many people are aware of it. Most people are innocent bystanders. They don't want to risk going to court, whatever. I just want to state to everybody here that in case you find somebody who has met with an accident, please get him to the hospital. We'll not even ask who got him. We'll not question you. I mean, we'll treat you like an informant, basically. Informant is person who is not brought on record, basically, right? So that's one. The other one is, today the response is far better compared to what it was. It needs to go the extra mile in terms of even getting a patient from the incident spot to the hospital. Better ambulances would be required. For us to even reach to the spot, certain delays are there, which we need to mitigate those and reduce those delays. So there is no, I wouldn't go in terms of saying a specialized wing is required. I think better training on our part also in terms of giving basic, say a CPR or something like that. In fact, including myself, all of us have undergone courses. We undergo refresher courses every 6 months to give basic CPR and how they need to be shifted immediately. The response in cities is very good, but like you said, on highways, the time taken to reach to the spot and evacuating the person from the spot to the hospital takes some time. But the response is getting better. All the highways have ambulances now. 112 is there where you can dial directly 112 and they will reach the spot immediately. In Bangalore city, 112, the response time is 7 minutes from the time of call to us reaching to the spot, in spite of all the traffic, right? Average. So it is getting better. Yeah, but we require participation and cooperation of everybody, because the person who's right there is in the best possible position to help the person in need. Yeah. Thank you.
So I have one last question, sir, to Dr. Dhaval Shukla, sir. So when we see head injuries, we are the first people, if there's an accident and we see there's a head injury, what is the immediate response as commoners that we should do in order to prevent it aggravating? Apart from, shifting the person to the hospital, what is the measure that we can do? Also, sir, how can we leverage like the drone system and other new facilities which are emerging in technology, and how can we, prevent the head injury from aggravating or the person getting into coma?
Good. So
So that is actually a very good question. I highly appreciate that you are thinking of it, right? Like other person asked that people don't even bother if somebody is injured. So there are two components, like one is systemic injuries and one is brain injury per se. So particularly when you talk of youth and particularly very small children, the bleeding from the scalp, like scalp bleeding is much more than the bleeding which occurs due to cut in hand or on the skin of the abdomen or legs. And that blood loss can be significant and it itself can cause death even if there is no brain injury. So when you see a bleeding from the scalp, first thing, if you have clean towel or clean handkerchief or something like that, you just press and stop the bleeding. That is the first thing you should do. And second thing, like just talk to the patient. Like just ask what is his name, where is he from or something. Is he responding or not responding? Ask him to move his hands, legs, etc. So if a person is responding, like he's able to tell his name, where he's working, etc., or where he's studying, that means you can be ensure that at least immediately after the impact there is no severe brain injury. So patient has probably mild or moderate traumatic brain injury, and there is no need to rush. So first things, just look for the other injuries, stop bleeding, etc., and call the take the phone number, call the relatives or ambulance or whatever. And when it comes, if the patient is not responding, like patient is in coma, now here lies the role of responsible citizen. Like when, like for youth particularly, when I ask any young boy or girl, I want to buy football studs, he'll immediately tell there is a shop near Jayanagar 4th block, something like I want to eat pizza or go to pub, they know. Similarly, you should be aware where are the hospitals in and around the road where you commute daily. So you should know there is a neurosurgical hospital where in relationship to that particular cross or highway or etc. So if the person is in coma, don't take him to immediately available next hospital. Like immediately available next hospital may be maternity home. And they may not be geared to take care of a comatose victim. And what you do, you just waste time. So you should be aware if the patient is not responding, patient is not obeying command, take him to hospital which provides neurosurgical services which has 24-hour CT scanner available. Because immediately CT scan is required and may require intensive care or even surgery. So this is where you should triage the patient with any injuries, not only head injuries. So this is something. And regarding technology and drone, you were told, I think Nishit, I heard from him, from Johns Hopkins, they have made an app, like with your mobile phone, there is a face distress scale. You can show the camera of the mobile phone to the head injury victim. And from AI, the distress on the face, it will recognize the severity of the injury and it will alert where is the next available hospital for such type of injuries, and you can consider. And sometimes even it will alert the hospital or the ambulances surrounding, which will immediately come and pick up the person. Currently, we do not have that technology in our country. But as I told you, the warning sign, red flags, like patient is not obeying commands, you shift to the CT scanner and neurosurgical center. Patient is obeying command, just stop bleeding and wait.
So everyone beautifully explained how the individual's faults, they have to take the safeguards in order to prevent it. I would love to hear how the indirect aspects such as our very own road infrastructure or our own government licensing authorities or even the traffic congestion leads to our very theme we are discussing, and how we can maybe overcome all this.
So I would like to answer your question. One thing is we have to realize that road crashes and injuries are a public health problem due to the burden and impact. To solve this public health problem, we need a public health approach. So one of the important is the safe systems approaches. So whatever you are saying, the indirect reasons, apart from the human behavioral factors, all needs to be addressed. So it cannot work in silos. There should be district and state level action plans on what measures need to be done to ensure safer human behaviors, safer vehicles, safer road infrastructure and better road audits, safer or good quality road safety management systems, and even the safer environments. So all these needs to happen together. So we cannot just address the direct part. If you actually look at the ecosystem over the years, our vehicles have become safer, our roads have become better and safer to some extent because the road audits have been started and they are improving. So the entire ecosystem is happening in such a way that recognizing that crash can happen, but in an event of crash, the person should not lose his life. That's the larger vision in which the indirect components are being strengthened. So working backwards from the targets that is set at the country level to reduce road deaths by 50%, which is a part of commitment of all the G20 countries here for this decade of action 2021 to 2030, that we will reduce our deaths by 50%. To achieve this, when we work backwards, all your indirect factors are likely to be addressed. Yes, I agree that they may not be addressed to the expectation which you have, or we like to have high expectations, but all these are being addressed, and you can give your opinion on this as well, any of the panelists.
You rightly mentioned that this is a public health problem. Many departments are involved: road transport, traffic police, health, education, and finally the researchers to give us the data. The first step is collaboration. Now you can see the collaboration. It has already started with the epidemiologists, with the researchers, with the experts, and the department there. First is collaborate. We need to work in synergy. We need to develop that and then converge. And finally, we need to integrate all our efforts. It goes from like education, enforcement. They need to talk each other. Now, gone are the days, when only the enforcement is there or the education. We need to talk to each other. And this, I really want to congratulate NIMHANS for this sort of panel. When you have, I am also imagining we have youth sitting here. You are the victims of road traffic accidents, or the volunteers who have helped the victims of road traffic accidents, which would actually help others or motivate others for this. So the time has come, sir, for this. Yeah.
So before we wind up, if any of the panelists, Anuchet sir, if you have anything to give a last message. Dr. Dhaval Shukla sir. Last message.
Like after
one
head
key
injury,
message.
yeah, after head injury, you will not be the same person again.
Yeah.
So that is the key message.
Yes. Key message.
I think one key message here is that what all the panelists have been trying to say is that road safety is a shared responsibility. It just doesn't depend on enforcement, police, transport, or public work department, but it also depends on all of us. We are the majority shareholder of road safety. We need to do our due diligence. How many of you here are trained in BLS? BLS means basic life support.
Actually, all NIMHANS staff is supposed to undergo training. Huh? Ah.
Exactly. So I would urge all of you to be at least trained in BLS. This is not just for road safety, but also it might help anyone in need, your friends, family, neighbors. So BLS is one thing, it's very important. I think coming to the question Mr. Anuchet was talking about, the Good Samaritan law, the members of the public have the highest chance of improving survival of those injured in road safety, in road accidents. When you call an ambulance, it probably takes 10, 15 minutes to come. There are people next to the injured person. They can do the basic due diligence, try to stop the bleeding. That can go a very long way in saving that person before the help arrives. So, as I said, it's a shared responsibility. Us, members of the public, have the highest responsibility.
Thank you. So with this, I would like to conclude this panel discussions, and I heartily thank all the panelists for making time of their busy schedule. Actually, they were very, very busy, but they've been able to take time of the schedule, come here, speak to all the G20 delegates, the Y20 delegates, and share their opinions on how road safety issues can be improved in our country as well as the other G20 countries. I now hand over to Dr. Kirti to complete the formalities.
I would want to thank all the panelists for this very interesting and enlightening session. And the bottom line is that each one of us has a role to play to make our roads safe for everyone. I also want to thank our audience for their active participation. Now, without further delay, I would want to request Dr. Bindukuti ma'am, Professor, Department of Neurophysiology and Dean Basic Sciences, to hand over the mementos to our panelists. Panelists to please move to Hall C for the media bite. And all the delegates, we are going to have a lunch break right now, and after that we can assemble for the next panel discussion. And all the certificates are at the registration counter. Post lunch, all of you can please collect your certificates. Thank you, everyone.